Welcome everybody to the first IFAM seminar of the 2022-23 academic year. My name is Adela Mizrachi. I'm a communications specialist at IFAM. I just want to make a few housekeeping notes. As many of you already know, we hold seminars most Thursdays during the academic year, so you can always go to our website and check out our upcoming schedule. This year, we're going to offer all of our seminars via Zoom, but also some of them will be hybrid, so we will offer them in person. And so you should make note on the different seminars. If you do attend in person, we will offer lunch too. And also, I want to let everybody know that we have an upcoming IFAM Population Health Forum and 10-year anniversary on December 8th. We will also have a poster session that day, so check out our website for more information on that. I will post a link to all of this stuff in the chat shortly. Anyway, so we are so excited to kick off this year with a presentation by Dan Weissman. Dan is a seasoned journalist and the creator of An Arm and a Leg podcast, which is an award-winning podcast about the cost of healthcare. He is a former staff reporter for public radio's Marketplace and Chicago's WBEZ, and his stories have appeared on Planet Money, Reveal, Code Switch, Latino USA, and NPR's All Things Considered and Morning Edition. So I want to welcome Dan. One more housekeeping note. We will have time at the end for questions. So if you have questions, please feel free to ask them, but please use the Q&A and not the chat to pose your questions. We won't be monitoring the chat for questions. And pose them as you have them. That's totally fine, but we will wait until the end to address them. So welcome, Dan.
Thanks so much. Thanks, Adela. And hi, everybody. Thank you for coming. I want to address a little discrepancy between the publicized title and this subtitle you're seeing here. I think the official note of this is about addressing the affordability crisis in U.S. healthcare. And I've added, in the absence of systemic reform, which is not to say that systemic reform is not needed. I think it is, just spoiler alert, but I don't think we're close to seeing it. So what do we do in the meantime? That is the major project of An Arm and a Leg. It's been my major project for the last few years. And so what's an arm and a leg? I wrote recently an official mission statement, which I hadn't done before. And this is what we say. It's a project that informs and empowers people as they confront the runaway cost of healthcare in the United States. We aim to engage a public, spurring self-help, mutual aid, and civic participation through journalism that is rigorous and community-focused and produced in entertaining, accessible formats that invite feedback and participation. But this is how we usually put it. This is An Arm and a Leg, a show about why healthcare costs so freaking much and what we can maybe do about it. I'm Dan Weissman. I'm a reporter, and I like a challenge. So our job on this show is to take one of the most enraging, terrifying, depressing parts of American life and bring you something entertaining, empowering, and useful. So that's how we usually say that. It's how I describe the show in every episode, right? A show about why healthcare costs so freaking much, what we can maybe do about it, created by a reporter who likes a challenge. And it's so that aims to be entertaining and empowering and useful. And so I want to introduce you to the folks who do this, right? There's me, and Adela, thank you for that introduction. I work with colleagues. Daisy Rosario has been with the project from the beginning. It's our consulting managing producer, meaning she's, in addition to having an editor, she's the person the editor and I go to, as if we were working in a newsroom, we'd both report up to somebody with whom we could confer and strategize. And Daisy's that person. She was a senior producer at Latino USA. She's currently running podcasts at Slate. She's spectacular. Marion Wang is our editor. She's currently a senior producer at Last Week Tonight with John Oliver. There's a whole staff of journalists who work on that show. Marion's one of them. She's last week she won her 3rd Emmy Award for her work on that show. Previously, she was an investigative reporter at ProPublica. And we work with Kaiser Health News. They're our co-producers. They give us some editorial advice and support. They support us a little bit financially. They're just really, and if you don't know them, you're probably not here. You're probably the kind of person who knows who Kaiser Health News is, but they're the kind of leading newsroom on healthcare in the US, in my opinion. So somebody might dispute that, but I think they do a really good job. And so wait, there's a question you might have, although again, if you're here, maybe not. like we have an affordability crisis. I'm just going to walk you through some data points that seem especially salient to me. Number one, insurance premiums keep taking bigger and bigger bites out of workers' paychecks. And this is in two ways, because this chart from Kaiser Family Foundation, which is the parent organization to Kaiser Health News, shows a couple of interesting things. And one is you can see the lighter blue pieces of these bars on the right shows what actually comes directly out of workers' pockets. And that's grown from $1,500 20 years ago to almost $6,000 today, 4 times as much. That's a lot. But the growth in what's called the employer contribution is also really significant. Also, it's grown by about 4 times. It was about $4,000. It grew to more than $16,000 because money my employer puts toward my health insurance premium is money my employer could be paying me. So this, you could say, and I would say that this entire bar, the growth of this entire each of these bars represents wage compression. So insurance premiums, so it's both that we have money that we're paying more, but also we have less money in our pockets to pay the parts of the medical bills that insurance does not cover. And these are and again, this is like when people say I have good insurance, they mean I get it through my job. This is what I think we tend to consider the best case scenario. And then there's another part of it, right? That money that comes out of our pockets, which is deductibles. They are going up too, to $3,900. And this is average. So some people pay more, like a lot more, right? That's for a family. For an individual, $2,000, so about half as much. It's a lot. And then here's an interesting follow-up chart, which is the percentage of workers enrolled in a plan with a deductible of $2,000 or more, which is to say, how many people are actually exposed to these giant deductibles? The answer is a lot, a lot of us. So what that adds up to is an affordability crisis. And what that means, because people are on the hook, people are getting less money in their paychecks, they're paying more, they're on the hook for more money to pay medical bills. And what we get is this is an enraging, terrifying, depressing report. If you have not read it, make time for it and make time to be nice to yourself afterwards, because it is really full of distressing and fairly authoritative news about how many people are under kind of crushing medical debt that's systemic. This isn't a story about 4 out of 10 Americans not being able to restrain themselves and taking wild vacations. This is a story about 4 in 10 Americans being subject to really high prices that are more than they can pay. And so this is not something I tend to dwell on a lot in An Arm and a Leg, but it underlies everything that we do. So yes, in my opinion, we have an affordability crisis. I clued into this, without even looking as I started working on this show. So, I started working on An Arm and a Leg in early 2018. I had a kind of crazy idea. I was like, well, what if, I thought I had an intuition, a sense that the cost of healthcare, the price of healthcare was kind of underreported and underwitnessed. I'd done stories, about people facing big medical bills. I'd seen other people's stories. They were, the thing about these stories, I thought as a reporter, is that they were striking in the way that they connected, as I was just saying, the specific individual circumstances of people's lives, which are often very emotional, because, if you've got a big medical bill, you've been through something very difficult in terms of your health. And now you're going through something super difficult in terms of your finances. People are at, critical junctures, which, as a reporter, it's like, oh yeah, that's what makes a good story, a compelling story. And that the issues people are up against are systemic, that it gives us a chance to kind of look from the bottom of what one reporter I know called kind of the ladder of abstraction and climb all the way up to the top, because the policies and the questions that get raised are systemic. And they're often, appealing to me, places like Planet Money and Marketplace, or kind of where I come from, really interestingly complex. nerdy. There's a kind of pleasure of sorts to be gotten from them. And so I started talking with people about whether this might be a good idea. And the big surprise was that everybody that I talked to had a story. I talked to Pablo, he's a dad at my kid's school. I tell him about this idea one day after drop off, and he's like, oh yeah, my wife makes less money than I do, but the insurance coverage at her job is good. And he tells me this story, like their family moved a few years ago, and he felt kind of short of breath at the end of the day, which was new for him. He was in good shape. He called his doctor. She said to come in, and she does an EKG and comes right back. She's like, you had a heart attack. You have to be admitted like right now. And he left the hospital a week later after about $300,000 worth of medical care. And he was told, if you had not come in, this would have happened again, but you would have died pretty much right away. And he says, yeah, if we didn't have this really good insurance, I wouldn't have gone in, I would have blown it off. So then I'm talking to my friend Peter, the real estate developer. These are not people I'm asking like, hey, do you have a story about being up against it with the medical system? These are people I'm just like saying, hey, this kind of crazy idea. What do you think? Peter's someone, the sharp business guy. And he's like, oh yeah, did I tell you about that when I had the kidney stone? He avoided seeing a doctor for as long as he could. He thought it would just be getting involved in like some super expensive, unhelpful ripoff until things got so bad his wife made him go to the ER. And he just kicks himself. He was like, I allowed them to give me a CAT scan. He said it told me I had a kidney stone and it was passing, which I already knew. And the bill was $6,500, which was his share, right? He had a super high deductible in his insurance at work. And I'm like, Peter, the thing about this story is that you're a real estate developer. And it's not just that you might have $6,500 when not everybody would, but like you negotiate for a living with people I would never come near. And this is one that's outside of your capacity. He's like, tell me about it. And then I talked to my friend Nyla, who said, I have great insurance. She was a state employee at the time. And when we talked, she had just come through a year of fighting breast cancer. She diagnosed at age 41, did surgery, chemo, radiation, everything. But great insurance doesn't mean perfect. So early on, before her surgery, she got a bill for like $6,000.
And I had a heart attack. Well, I mean, literally, obviously. But I opened it and I was already not in a good place. There was a lot of crying. I opened the bill and I just started crying.
That one actually got straightened out with help from a hospital social worker. But later, there was another moment where the person Nyla called the money woman from the hospital came up to her in the emergency room and hit her up for $2,000. Oh, and then there was like a full year she spent haggling with her insurance about reimbursement for the wig she got when her hair came out. And still, this was what she said.
I think I had a good experience. Honestly, I think I had a good experience. Like I know people, women my age, who have gone through breast cancer and had to create like GoFundMe campaigns to pay for their chemotherapy.
Yeah. It's dark. But here's the other thing in that conversation with Nyla. Again, I had not called her saying like, hey, Nyla, you had cancer. How'd it go with the money? She raised that. I called her and said like, hey, Nyla, you're a radio person. I respect your opinion. What do you think about this crazy idea I have? And she was like, well, here's the thing. There sure are a lot of those stories, but, she was not so sure that that idea was going to work because she had a big question. Who's going to listen to that? Because it's one thing to come across an enraging, terrifying, depressing story in the news. It's like coming at you every day. And it's a whole other thing to set time aside for a story like that every week. I mean, who would do that when you could do anything else? So I kept talking but I still thought I wanted to do this. I was looking for a way to do it. And so I kept talking with friends and taking notes. And that's how I landed here with this. The name, an arm and a leg, and this logo inspired by 1950s movie posters, and the copy you see here that you've already heard. That this is one of the first things I wrote in my notebook. The show has to be more entertaining, empowering, and at least occasionally useful than enraging and terrifying and depressing. So, okay, I'm gonna go for it. I needed some stories. I started asking around. Now I was asking for stories, and the best one came from this man right here. This is my oldest and dearest friend, Joshua Safford. He's been making his living performing at Renaissance fairs for decades. And I mentioned what I was doing. I was looking for stories about people addressing the problem. He was like, oh yeah, that's what we do with Rescue. Like, what's Rescue? It's this. The Rescue Foundation, no E at the end, is like, it's this handcrafted safety net that Rennies, that's what people in that world call themselves, have created for each other when they're up against medical bills. And they fund Rescue with benefit parties they hold for each other. They auction off tchotchkes and all kinds of stuff. So I wanted to see this for myself, and I booked a flight to Texas, where the next fundraiser was scheduled at the Sherwood Forest Fair outside Austin. And I asked Planet Money if they'd be interested in the story. They were like, yeah, that sounds pretty fun. And, it was.
Have you gotten the chance to speak with Robin Hood yet? Robin! Come forward.
Robin Hood does that thing they all do at Renaissance fairs where they pretend to be amazed by modern technology, like my microphone.
It's a very strange device you have there, sir.
A lot of people say that here.
That's interesting. I can imagine.
Another newfangled invention they don't all have? Health insurance.
Hence rescue. It was pretty cool. It was lovely to spend time with those people. And, I went to one of their benefits. They did a great job. And here's the interesting part that happened way outside of that world, way outside of that scene. When I was doing the story, they had just raised for the past 5 years about $500,000 from those fundraisers, which is a big accomplishment. I mean, these are people who don't have a lot of money to begin with. But in that same amount of time, they made more than $2 million in medical bills just go away. And I was like, that is real wizardry, yon Ren Fair folk. And here, this is the wizard. Kaylin Globig. She is Rescue's case manager and head of advocacy. So making that $2 million a year go away, $2 million go away it's a half-time job for her. She works as a real estate agent half the week. Once upon a time, she was a rennie. She was selling belly dancing outfits. And at one point in that time, she ran into this scary medical adventure, ended up with a bill for $5,000, which she didn't have. She called the hospital. She was like crying. They gave her a charity care application, which still left her on the hook for $700, which she could not afford. And Rescue helped her, and she became a volunteer. And eventually she got off the road, and this became her life, helping people advocate for themselves and sometimes getting directly involved. She told me she learned a lot of tricks.
There are roads to take when you're uninsured. It's just that people don't know how to do it, and they won't necessarily tell you.
Yeah. But she told me about her wizardly strategies. So yeah, ask about charity care, negotiate, keep calm, always be gracious, push hard when you have to, and use data. That part was interesting. Here, check this out.
The super bill has all of the codes.
So to set this up, she said, you got to ask for the super bill, which I've since learned you call an itemized bill of all charges. And this is how she uses it.
The super bill has all of the codes for each procedure that this person has had as they're going through their medical adventure. And I look up those codes and I see how much Medicare will pay for those.
Yeah. And then she goes back to the hospital and says, would you consider taking the Medicare rate for this? And, sometimes it works. She was blowing my mind. I was like, looking back at this, I've spent a lot of the last few years since meeting her, learning more about these strategies and sharing them with listeners. And at the time, at the end of this episode, I said, it would be hard to scale something like what Kaylin's doing because, she's like serving her people. They're like tribe. And, she knows them essentially, even if not individually. She knows who these kind of people are, people who put their lives into Renaissance fairs. They're awesome. But I also figured there were probably more people like Kaylin out there. And so at the end of the episode, I said, if you know someone like that, or if you are someone like that, would you please get in touch? And then I got this email. I am that person, like your Robin Hood. You asked for someone who's good at handling these bills. That's me. Thank you. For the first time in a long time, hearing your podcast has made me feel like a real life superhero and positive about the life I've lived. I'm your neighbor just down the street, worked online and in and around the type 1 diabetes community off and on, and have gotten good at handling medical bills. Countless stories, written comics about living with chronic illness. But one of the things I'm proud of is my ability to navigate healthcare as a patient. I've gotten thousands of dollars in bills reduced or removed, just plain made disappear for myself and helped others. It's a combination of extreme couponing, phone negotiations, letter writing, and lots of paperwork and receipt keeping. I'm still scared to death each year of my insurance changing, but that's another thing altogether. I'd love to tell you more tricks of the trade, like getting drugs covered, free appointments, etc. Okay, let's meet. It took a while. I had stories stacked up. But when we got together, we talked for hours. We talked in Meredith's backyard, across her kitchen table, in my home studio. And her story was, harrowing. There were tears. There was triumphs. There were triumphs. It was a lot. But, she's living her life in Evanston with her husband and their son. He was 3 when I met him. She spends a certain amount of her free time hanging out in Facebook groups or on Reddit boards where people ask, how do I deal with this unpayable medical bill? And she's got advice for them. She likes being able to help other people. You're looking now at a quote from one of her posts. There's a lot of them. And this, in essence, was her bottom line.
Like, there's only 3 things that you're fighting. Problems with competence, problems with greed, and problems with maliciousness. And luckily, most things are incompetence.
Right. So what she means, I think, is there's a process for asking for the help or just the recognition that you need, that you're entitled to a break of some kind, or that, you know, there's help for you. But the probability of something going wrong on the other side, them losing the form, even though you filed it, or just not really understanding their own rules, or not telling you what you need to know, it's really, really big. And so if you're calm and persistent and organized, you can take on 100% of the burden of competence, which is a lot to ask of anybody. But, you know, there it is. I should mention here, in the first couple of seasons, I really thought of our show as being like Planet Money for healthcare, with maybe death, sex, and money thrown in, like market failures, relatable stories. As we got ready for our 3rd season, after getting hundreds and hundreds of emails from listeners, and all of them were wild, and a lot of them were enraging and terrifying and depressing, I was like, the theme for our 3rd season needs to be practical self-defense and mutual aid, which can take a lot of forms too, right? Like, so there's Stephanie Whittles in Texas, whose daughter was born hearing impaired, and who mounted a campaign and won to get insurance to cover hearing aids for kids with hearing disabilities in Texas, which hadn't been required before. I should mention Stephanie's own daughter was taken care of. She'd found resources, but she was mad and had some energy for it. We investigated questions like, can they freaking do that? So a woman got a bill for $35. The follow-up said, if you don't pay it right away, it's $1,300. And then they tried to collect. And we were curious about the legality of that. It turns out the answer is, it's not illegal for them to send you those notices, but it doesn't mean they're really legally entitled to collect that amount from you. There's a process. You can get the law on your side. Again, like, no one's going to tell you that. It took me some real digging to find it out. So that was our 3rd season. Self-defense took a lot of forms. And at the end of that season, we did a debrief with my reporter pal, Sally Herships. And, the most memorable part of that conversation was, I said, like, we profiled a medical bill ninja. Maybe we should find a way to build a dojo, like a school for self-defense, which, it's a metaphor, right? I wasn't going to wreck the building, but it was how we started to think about what our next season would be like. So we posted that, recapped that conversation in February 2020, and started planning a kind of building the dojo season for summer 2020. But of course, something happened first. And suddenly we weren't going to do it. We thought, we didn't think anything in our summer building the dojo season would necessarily hold. A couple weeks after the lockdown started, we were doing a pop-up season about the cost of COVID. And Sally Herships was in the first episode of that one as a character. It's her on the upper right-hand corner. She was part of an ad hoc group that started gathering and distributing donated PPE and fabricating face shields for a public hospital in Brooklyn. Eventually, we made season 4. The characters were people who could be teachers in our completely theoretical dojo. There was a woman who worked for an insurance agency where they really prized customer service. And so when people had questions or problems, she would, with their coverage, she called the insurance company and got answers. And she was terrific. Shauna Burns got super famous on TikTok, dishing out advice about handling medical bills and handling debt collectors. And she was fabulous. And we did an episode, maybe my favorite, where we talked to a real life self-defense instructor about, that thing that both Caitlin and Meredith talked about, of keeping, you have the burden of being calm and productive always, which is hard. And that's a really important set of lessons. So, here we go. Yeah. So we wrapped our 4th season, and people start tagging the show on Twitter again with another TikTok video. That was how we learned about Shauna Burns. And this TikTok video turns out to be this.
What's a piece of information that you learned that feels illegal to know?
Most hospitals in America are nonprofits, which means they have to have financial assistance or charity care policies. This is going to sound weird, but what that means is that if you make under a certain amount of money, the hospital legally has to forgive your medical bills. Let me show you how this works. Type in the hospital name with financial assistance after it. Should be the top link. Let's check. What you want to do is look for financial assistance applications and policies. Let's check the policy. From here, what you're looking for is a sliding scale benefits. So right here, 0 to 300% of the federal poverty guidelines, they will forgive 100% of your medical bills. So you can see here that 300% of the federal poverty guidelines is $37,470. So if you make under that amount, the hospital will legally forgive your medical bills. And if you're a larger household, you can check it out from here. If you want to test it out, I run a nonprofit that does this. So DM me and I will actually do it for you. Let's see if we can crush those medical bills.
That video got watched like 10 million times in its first few days, and that turned into our next episode.
What's a piece of information that you learned that feels illegal to know?
Try this. It's Jared. He says, I crush hospital bills. Test me. This 60-second video offers a legal recipe for zapping billions in medical debt, and it works because it turns out the nugget here, nonprofit hospitals are legally obligated to offer financial assistance policies, and you can hold them to those policies. That's true. And like Jared had this super interesting story. He had started $4 when he was in college. He was working his way through managing some trampoline parks. A couple of folks in his family had big medical events, not financial disasters, but everybody like held their breath. It got him thinking. And so he initially organized $4 to just collect $1 a month from people in Portland where he lives. The idea that every month they'd help some family pay their medical bills. It was in 2015, before TikTok, before GoFundMe got really big. And eventually someone introduced him to an attorney, potential board member, who came to him with this proposal. He said, you could just wipe out people's medical bills by helping them apply for charity care. And Jared was not convinced, but he did like the idea of an attorney joining his board. So he said, sure, we can explore that at some point.
At that point, I'm still thinking like, okay, man, like this isn't real, you know? He was like, no, let me show you how this can work. He got a couple bills to go away, and I'm thinking, what the hell have I been doing this whole time? So once Eli showed me that, I was like, okay, well, we're changing our model real quick.
So they changed the model. Jared and Eli collected the charity care policies from nearby hospitals, put together a web form so people could plug in their financial information in the hospital they were seen, get a quick read on whether they'd qualify for financial assistance. If you qualified, they would help you. So that's the offer Jared made at the end of this video. I run a nonprofit that does this. Hit me up if you want help. But he'd made that video on a whim. He had no idea how many people would see it, like how many people would ask for help. He was not really scaled for the thousands and thousands of requests he got. And the whole thing raised a question, which is, what does scale look like? Like, for one thing, how many people are out there who could qualify for charity care and are not getting it? The answer turned out to be a lot, like $2.7 billion in the course of a single year. This is thanks to my colleague Jordan Rao at KHN. These estimates come from hospitals themselves. They're required to report to the IRS how much bad debt they write off every year and how much of that bad debt they think could have been forgiven through their own financial assistance program. So Jordan pulled those reports for a single year. This was the number, $2.7 billion. So how this happens, there's a whole other investigation, years long, right? But there were some places from Jordan's reporting looked like what I might call bad actors, like a state attorney general had sued a hospital in Washington that apparently trained their staff to blow off requests for financial aid applications. On the other hand, I talked to a consultant who said some hospitals are very diligent about screening patients for financial assistance because, it's more cost effective, not to mention nicer than spending money chasing people for bills they can't pay. But for whatever the reason, it is clear from Jordan's reporting the universe of people who could use help from someone like Jared is really big. And for some people, the information in Jared's 60-second video was all the help they needed once he was diving in, and was all the help that they needed. So, and meanwhile, he was diving in to help the people who needed his help. So you can see on this tweet, there are people who just got in touch with him like, thank you, I used this. I wiped out more than $15,000. So Jared, meanwhile, though, has thousands of people contacting him. One of his board members ran an agency for hiring virtual assistants. He hooked Jared up with a discount. Jared started putting these people to work. And he loved being able to put his specialized knowledge to use, including state-specific laws that give patients extra rights. And I just love this story so much. And I was like, well, okay, there's a big scale to be had here. How can it scale? Jared's one guy, maybe some virtual assistants, and he's suddenly having these thousands of requests for help. And given the size of the problem he's working, that's just the beginning. Like less than 6 months later, I saw the beginnings of an answer. Because after our story ran, Jared heard from a lot of folks who wanted to volunteer and help him. And a couple of them became super volunteers. These were tech folks with time on their hands. And they wrangled another 35 or so folks and built a strategy for getting the work done. One of them told me she was working 30-hour weeks and had worked straight through a weekend. And the team collected charity care policies from every nonprofit hospital they could find. Most were easy. Some took some hunting. They logged them into a database from which they built a web app. So here's what $4's homepage looks like today. If you click on Get Help Now, you come here, a quick orientation. You may not have to pay that hospital bill. See if you qualify. It'll take you about 3 minutes. And if your bill is for a hospital, you get this form. Fill it out. They'll tell you whether you seem to qualify for financial assistance from the hospital where you were seen. And you get asked, do you want us to help you apply, or do you want to do it yourself? If you want help, you'll get put in touch with a member of their small but mighty staff. They're going to be seeing your financial records and stuff. It's not a function volunteers can fulfill. But if you say, do it myself, you get led through a whole series of tips and instructions, and you get messages from $4 asking how it's going. If you'd like help or advice from somebody, volunteers can help you there. If you really get stuck, you can always have someone from $4 staff handle the process. So that was big. That was less than 6 months later. And then Jared started leading open trainings on Zoom. My colleague, Emily Pisacreta, sat in on one last September. He told folks, even if you don't volunteer directly with us, you can just help out people in your own life. Emily distilled the top lessons from that training into the story that ran on KHN. We had a version of it too. And he kept going. So by this summer, Jared told me they'd wiped out about $18 million in medical debt. He sends out tweets like this pretty much every week. That incredible backlog, all those thousands of people, they're in the rearview mirror. And Jared thinks his system now is strong enough. If they had another huge surge, he could handle it. He said the biggest challenge $4 has right now is finding enough people to help. He's like, we had our moment on TikTok, but who's on TikTok? Young people who has a lot of medical bills. Older people have a lot of medical bills. Yeah, he's got a lot of room to grow, right? $18 million is a lot, but $2.7 billion a year that hospitals themselves say could be written off as charity care under their own policies, that's much bigger. So Jared's looking at how to build awareness. And meanwhile, he's moving on already to something potentially bigger. Because that $2.7 billion gap is not the whole driver of medical debts people can't pay. That's this overall affordability crisis. So Jared's done some envelopes. I think it's back of the envelope, some estimates. I think they're back of the envelope math. He thinks maybe 30% of Americans qualify for financial assistance under existing policies, but he thinks a lot more people than that, maybe twice as many, are at risk for getting socked with medical bills they can't pay. Whatever that number really is, it's a lot, right? Deductibles are high. There's then not even captured any of these. There's co-insurance, right? Your share of a hospital bill after your insurance is paid up. So like I pay a lot for health insurance. My co-insurance is 20%. You run into serious medical trouble of any kind, that 20% is going to look like thousands and thousands of dollars. And you and I know most people don't have thousands of dollars just sitting around. And Jared knows it too. And he also knows, like Meredith Balo knows, and Kaylin Globig knows, and Shauna Burns, our TikTok mom, knows, and lots of other people I've talked to. If you're persistent and organized enough, you can often get through to somebody who may cut you a deal. Even if you're at the point where you're being chased by debt collectors, because the amount you're being billed for may not be the amount whoever's billing you for would accept. They might accept less from Medicare or Medicaid. Maybe they would take that from you in this case, instead of spending the rest of their lives chasing you. But again, it takes a lot of work. So, but here's Jared's latest project, is figuring out exactly what that takes at some kind of scale. He got a grant. He's hired a couple of people we trust to help patients go through this process. And they're collecting data on what they encounter. So I got to sit in on a call with Jared's colleague, Eli, over the summer, and it was not that fun. He was working with a woman who owed about $1,700 dating back to the birth of her son 4 years ago. And it took the better part of an hour just for Eli to get someone from the debt collection agency to agree to speak with him and get some basic information from them that he could use to help his client form a strategy. And this woman was living paycheck to paycheck and not actually making ends meet. And now, according to their strategy, she's going to try to save a few $100s over the next few weeks to see if she can get it paid off in a lump sum at a discount. It was tough to listen to. And afterwards, Eli said he didn't see how boots on the ground efforts like this could scale, which is why this project is called a lab. They're collecting data, and Jared intends to use it. Oh yeah, here's his audio.
At the end of the lab, I want to be able to come out with a report. So we had 4 experts that were working on this X amount of patients to, and this was the impact, but
This is how many times our calls were transferred. This is how many times we were promised a call back and didn't get one. This is how many times this is how much time we waited on hold. This is how, every data point that we could possibly put together and then come out and say, this is why this is bullshit. Because then we can use that data to drive some real change.
Piling up receipts, piling up data like that really can make a difference. Just in the last year, I've covered stories about the implementation of the No Surprises Act, which protects patients from a phenomenon you probably know about it, but just in case, this was where you would go be seen, usually at a hospital, maybe at an emergency room, or maybe for surgery, at a hospital where your insurance was accepted, but you would be seen by somebody, the emergency room doctor, an anesthesiologist, a radiologist, who was not an employee of that hospital and was not in network with your insurance. And they were free to send you a bill directly for whatever they thought was reasonable. And it was billed as an out-of-network charge, and people were on the hook for amazing amounts of money. Years and years and years of reporters, especially Sarah Cliff first at Vox and then the New York Times, really got people's attention focused on this, and Congress finally did something about it. And that law, the No Surprises Act, took effect this year. There have been other things. Last year in Maryland, advocates really piled up a lot of data about hospitals suing patients who qualified for their own financial assistance programs, and they got the Maryland legislature to unanimously outlaw that practice. Earlier this year, credit reporting bureaus agreed to take most medical bills off of credit reports, which is a big thing, right? People are being chased for a medical bill, and they're told, like, well, if you don't pay this, it goes in your medical report and hurts your credit, hurts you financially. That has gone away for a lot of people in a lot of cases, and that is good news. And then just last month, as part of the giant Inflation Reduction Act, there were pieces of it that dealt with Medicare, and one that got less attention, but that I found super interesting, was Congress put a cap on people's out-of-pocket expenses for drugs, which didn't exist before. And the amounts that people were paying, hundreds of thousands of people were paying tens of thousands of dollars, $10,000 or more for drugs they needed just to live every year. You're looking at, you may be familiar with, your scholars in this field, Stacey Justicina from Vanderbilt University. Her work was, as far as I can understand, critical in helping people understand and documenting the effect of not having a policy like this. So all of these changes required a lot of time and effort, compiling data and advocating to make sure decision makers understood it. And all of them were way too hard, and all of them still leave us with this giant affordability crisis. So this is honestly how most episodes of An Arm and a Leg end. There's a kind of like, on the one hand, this thing is amazing, so great what this person did, what these people are doing, what's just happened. On the other hand, the overall picture is really grim. And on the other hand, you're like, this is life. We live in a world that's got big, big problems, bigger than any of us, and it can be overwhelming. But there are things we can do to ameliorate misery now. There's those tweets that Jared sends out every week with the thousands and thousands of dollars of medical bills that he and his team have made disappear. And we can work for bigger changes over time. And it takes incredible dedication. I just think it's good, I like being in touch with people who are doing these things. And that's one thing that I offer for this show, right? That I think you'll enjoy and be heartened by in your own work and in your own efforts and in your life. Meeting people who are doing something, even though it's not solving the problem. There's no switch we can flip. We have to take an all of the above approach. So when I started working on this show, I said, I'm never running out of material, which is a kind of a dark joke. It feels super dark occasionally, but most of the time it is pretty clear that the material is the work people are doing for themselves and for each other. And that's why this is the best job I've ever had. I hope I get to keep doing it for a long time. Although I also kind of hope that the job goes totally out of date through some kind of miracle, and that I can move on to do something totally different. That would be cool too. That is my presentation. I think I came in 4 minutes early. I'm going to stop sharing my screen here. and see everybody here if I can. Thank you.
Thank you so much, Dan. That was really interesting. So for anybody who wants to go and listen to all of the back seasons of An Arm and a Leg, you can just find it on your podcast app of choice. You can also email ifam@northwestern.edu if you need help figuring that out. We have a question, and if anybody else in the audience has questions, they can post it in the Q&A. So I'll go ahead and read this one. Have you looked at the middle and upper middle income families who are also getting crushed for heart surgeries and cancer treatments? What options exist for them? I do not mean to diminish the impact of those at the poverty level with no coverage at all.
Yeah, absolutely. I mean, these are some of the folks that that I think Jared is targeting with his negotiation lab. It's certainly one of the things that we talk about on the show. I mean, it's one of the things that inspired the show, right? Like Pablo is one of those folks who, if he hadn't happened to have the coverage that he had, would have had a total unpayable bill. And that, as I mentioned, right, 20% adds up super fast. You're catching me pausing here because I'm like, okay, so what do I have for you? And the answer is, I wish I had, this is where I'm like, I wish I had better news, right? I wish I had better answers. I guess that's my answer to that. Yeah, I wish I had better answers for it.
And I'm just posting a link right now to $4, which is Jared's organization. He's the one that Dan has shown you like the clips of the TikTok. There's a couple of other people on TikTok, I think, that are also doing some really interesting things. I have a question. So I'm wondering, it seems like it's like this combination of advocacy, journalism, and research, right? That kind of goes together to then potentially impact policy. Can you point to any maybe episodes that people can listen to? Because I always like to, rather than telling somebody to go listen to a show, I like to point to specific episodes that might be a good starting point. Are there any, I think maybe I've listened to your show. Maybe the Stephanie Whittles-Wax one would be a good one, where there's all of this sort of input to then change the policy.
Yeah, I mean, of course, I'm like, I think they're all inspiring stories. That's why I'm doing them. But yeah, I think, and I would encourage you, our website is armandalegshow.com. And if you click on episodes and look at all the episodes, I'd say like, take your pick, because different things will appeal to different people among us. I do think the stories we've done several episodes at this point that either feature or touch on the work that Jared and $4 are doing. I think that work is really, really interesting. But the project that Stephanie Whittles-Wax did in Texas, I mean, she's such a terrific person, inspiring character. But yeah, like, check it out, take your pick, see what you like.
Great. So we have a couple more questions. In your opinion and experience, is Medicare for all a solution, or at least a step in the right direction?
Such a great question. I will tell you, as a matter of policy for myself, as a journalist, I avoid expressing opinions about the biggest kind of top level policy questions of the day, because we're in a kind of, you might have noticed, hyper-polarized environment. So, and that, once you kind of declare, this is a classic kind of journalist dodge, but like once you declare yourself on any question that kind of is part of that divide, some people decide to totally ignore you. And I think that the problems that we write about and the approaches that we highlight, apply to everybody. And so I'm aiming to keep that question, leave that question open. For me, there are lots of people with lots of opinions about it. I see a chat question. Have you spent much time discussing greed's impact on income inequality? A useless platitude is, it's the economy, stupid. More accurate version would be, it's greed. You arrogant intellectual. Yeah, I mean, I'm not making the big pronouncements, but it's obvious, right? That, and I think there's two things happening. One is, I mean, there's a million things happening, but one is because we operate in, our healthcare operates in this kind of for-profit world, even though many of the actors are technically nonprofits, there are a lot of operators out there who are really aiming to make a buck. And, you know, Martin Shkreli, right, is the kind of ultimate example. Insulin, the kind of price of insulin is another kind of big example where it appears to be driven by greed, right? And the other thing that happens, that even if you are the kind of best-hearted provider or operator, you're entering a world where you're operating in a world where you're kind of competing with or having to negotiate with all the sharks. So if you're running a hospital, you're dealing with every insurance company. Some of them, you know, many of them publicly traded companies whose mandate is to maximize shareholder value. Well, how are you going to manage that, right? You're buying medicine from companies that are out to maximize shareholder value. And so all of these things are constraints, right? They make it really hard for, and that meanwhile, as you know, one person, I think it's a platitude in the world of people who run things like nonprofit hospitals, they say, no margin, no mission, which, you know, can let people off the hook for doing things that they probably should really consider if they can do them in a better-hearted way, but also is not entirely untrue, right? It's a rough world that people can go broke in. So greed's a giant factor, and it constrains. I mean, one thing we have talked about a lot is we did an episode over the summer about a doctor who wrote a memoir that's really, really eloquent about the question of what's called moral injury, where he's an emergency room doctor, and he just experiences every day the degree to which what he knows in his heart and by his training he should do for the person in front of him is something he's constrained from doing. Spending more time with them, asking the next question, providing them the care they need right now. So again, I'm never running out of material. It's a lot. It's a big, complicated mess, and we're all looking. And you know, his way of looking for the light is to bring his full awareness into every interaction. There's a lot in his book, his memoir, about his own kind of mindfulness attempts of kind of practice of just like rooting himself, being present to the other person, doing everything that he can. And I think that's valuable for all of us too. Not an answer to the big question. But.
So we have a question. I'm not sure you're going to be able to answer this one, and I don't think I can answer this one. This might be more of a mentor-mentee kind of question, but how do you think medical schools would view volunteering with $4?
I don't know. I'm not a medical school administrator, but I'm going to tell you, I think it's a great idea. And I know that Jared has had some interest in like forming like student chapters, essentially. So I think that's a really, really I encourage you to give it a shot. And you know, like, how could they stop you? Why would they, like, you know? Why would they? Yeah.
I think, I'm not sure if the question is about medical schools sort of like putting it on your application if you're applying for medical school, whether that would be like a plus or a minus, or if it would be, you know, as you're in medical school, whether or not they would like look favorably on it. You know, there's a little bit potentially of a conflict of interest.
Question, right?
Yeah, but okay. I would encourage the asker to maybe talk to a mentor about that. So we have another question. Again, and I don't know if you can answer this, but we'll pose it to you. Can this be extended to asylum seekers, refugees, or others who don't qualify for Medicare or ACA?
I don't know the answer to that. I think the answer must be, but I believe I would, my big guess is it depends on the hospital. The law says, this is part of the Affordable Care Act actually, was for the first time required hospitals to have a charity care policy. It is silent about what the content of that policy is. So my editor always reminds me not to write in our scripts that hospitals are legally obligated to provide charity care, because they could have a charity care policy. Our charity care policy is we don't give any. And I've never heard of that. And possibly the IRS would have an issue with that, but it's untested. It's unproven that they have to have it. So, but by the same token, again, I think a hospital would consult their lawyers to see if there was any reason they would be constrained from offering charity care to folks in those kind of circumstances. But and I'm not that person. So yeah, another non-answer from me.
So we have a question in the chat. Do hospital budgets rely on this debt going unforgiven?
I think the answer is no. The amounts are not significant that I've seen compared with the kind of scale of a hospital budget. And often the amounts are low. So in New York, advocates from a group called the Community Service Society of New York pulled 50,000 lawsuits, like the data from 50,000 lawsuits that hospitals filed against patients in New York over a 5-year period. It was a sample. It wasn't, I don't think, the full universe, but that was a good sample. And they found that the median amount that hospitals were suing for was $1,900, which to a hospital of any size is nothing. So, and to the people being sued, it's everything. And, you just can't get blood from a stone. So I think, no, it's not. It's a project I'm working on for next year. Actually, I have some leads on what actually drives this phenomenon. So stay tuned.
Yeah, and that's actually a question I was going to ask you is like, do you want to tease any stories that you have coming up for next season, or you want to tell us a little bit about next season?
Gosh, thank you. I can tell you what's coming up in the next couple of months. Sure. Next week, my colleague Emily Pisacreta is looking at an initiative in California where the state is like, we're going to make our own insulin. People in California should have access to affordable insulin, so we're going to make it. There's also a nonprofit consortium called Civica RX that has been working on manufacturing generic medicines, and insulin is on their punch list. Like they've announced that they're doing it next year, or at least filing for FDA approval of what they're going to make. So I find that super interesting. Yeah. That
reminds me of potentially another episode I heard of yours, or maybe it was a different podcast about they were like basically hacking some sort of machine that monitored blood glucose levels.
Yeah. We looked at how insulin got to cost so much. We also talked to people who are making their own solutions. There is an effort out there, people to like make in a kind of community lab, make insulin on a kind of open source basis, which is super interesting. I think that's a very slow effort. But then there are people who are type 1 diabetics who use, these days, many people, rather than just inject themselves with syringes, have essentially something like a patch that kind of injects insulin on a kind of controlled drip, and what's called a continuous glucose monitor, where it monitors your blood sugar level and they can coordinate. The systems in those devices are closed, right? So they've hacked them in order to get better data out of them and better control their own blood sugar, basically. And they also, tend to use older equipment, which can be hacked more easily. So it's super, super interesting. But yeah, people are doing there's a kind of incredible ingenuity and kind of self-help at play.
Right. Final question for me, unless anybody else has questions they want to pose, is I know that you have a newsletter, or you recently launched a newsletter, so I want you to tell people about it, how to subscribe. I can post the link in the chat.
Sure. Yeah. Thank you. We actually have a couple of newsletters. One of them is just if you want to get reminders that we have a new episode, like I'll email you that, no problem. It's automated. But we started a project called First Aid Kit last year, which is our effort. And I was actually I was aiming to make a slide for it just before we went live. But and can I share my screen for a second to show?
Sure.
Okay, yeah. Cool. All right, let's see. It is here. It's this. First Aid Kit is a newsletter about how to kind of fight the enemy. the idea is, one thing that I said at the very top was that, we're aiming to engage and inform people and empower people through reporting, and a podcast isn't the only way to do that. And this project was started in response to a very, very frequent question from listeners, which is like, hey, you give out a lot of good advice in this show. Is it written down someplace? And so this is our attempt to kind of write it down in one place. One thing that I say is like, if I ever write a book, this is like the first draft in newsletter form. So we have so far looked at things like avoiding a big ER bill, avoiding some of the worst prescription drug ripoffs, avoiding overpaying for tests, how to understand your rights under the No Surprises Act. There's a bunch and how to shop for insurance, which is really, really complicated. It took us 3 installments of First Aid Kit to get to that one. So yeah, you can get to us at armandalegshow.com/newsletters.
I also put the Substack First Aid Kit link in the chat.
Yes, you can sign up directly there.
Yeah, and we also had one final question come in. So thyroid cancer patients have been found to have the highest rate of filing for bankruptcy protection following cancer treatment. Have you come across stories from people with thyroid cancer who have gone bankrupt? Not maybe a story idea.
Yeah, right. I don't recall hearing something. A good friend of mine has this problem. So I'm familiar with it. The universe of problems, right, that we see is effectively infinite. So I haven't looked at this one, but it's good to know. Thank you.
Yeah, and thank you. So I think we can wrap up now. Thank you to everybody who joined us. Thank you to Dan. We have seminars coming up every Thursday at noon, so you can go to the IFAM website and check it out. Thank you so much, everybody.
Thank you.
Bye, Dan. Thanks.
Bye-bye. Thank you.